Beauty means to me looking in the mirror and having confidence. Whether that is looking in the mirror and loving how you look, looking in the mirror and loving how you feel, or both. There is nothing better than having self-confidence. So truly seeking that internal and external self-confidence.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Kristina Thissen, a board-certified physician assistant with 13 years of experience in the aesthetics field. She started a career as a plastic surgery PA and spent 8 years of her career learning from top plastic surgeons. She established Remedy Medical Aesthetics and Wellness in 2021, and what started as a one-woman practice has grown to a multi-seven-figure business with 9 employees. Remedy recently relocated to a 3,000 square foot clinic with 6 treatment rooms and a training facility. She is a Galderma trainer as well as a key opinion leader for Sciton. So, Kristina, welcome and glad to have you here.
Thank you so much for having me today.
Yeah, so let's dive right into it. How did you first get interested in medicine? Let's start there.
Yes. When I was doing my undergraduate degree, I had originally started as a pre-dental
Hmm.
major. And as I explored that career a little further, I decided the dental field wasn't for me. I didn't want to spend my days in people's mouths. So I started shadowing different medical fields across the industry, whether it was, spending time in a physician's office, dermatology, and I landed on the physician assistant career. I loved the ability with a physician assistant degree to be very flexible as far as what my specialty might be. I wasn't exactly sure when I was, going through my undergraduate degree, what field of medicine I might want to specialize in.
Mhm.
So I loved the broad option of the physician assistant degree to not specialize. So I pursued actually a business degree as my undergraduate degree,
Okay.
which was very intriguing to people. They didn't
Mhm.
quite understand why I did that, but I knew in my head I potentially had a different plan one day. And then as well as my biology and chemistry minors. And then I went on to physician assistant school to get my master's degree. So
Okay.
definitely have always loved people. I
Mhm.
love caring for people. I love talking with people.
Mhm.
So that has always been my passion. I was a nanny in college, a babysitter, a lifeguard. I've always worked with people,
Mhm.
and I just knew that I had a passion for medicine.
Okay. So then what was it about the aesthetics industry that pulled you in that direction?
So during my schooling, I did a plastic surgery rotation, and that was the only rotation, one of the only rotations
Mhm.
I did not want to end. So I
Mm.
knew in my heart that pursuing plastic surgery was definitely my passion.
Mhm.
Ever as a physician assistant, it wasn't super common that plastic surgeons hired PAs at the time. This
Mhm.
was back in 2012.
Mhm.
A lot of plastic surgeons, have a private practice. PAs are definitely more expensive.
Mhm.
So it wasn't super common to find that option. So I actually started my career in family medicine and urgent care.
Okay. So now I guess your degree that you got in business, I guess it makes a lot more sense now that you have your own practice. That's what I want to ask you next. I guess that was kind of foreshadowing where you are now.
Yes.
But what was it? I guess why did you start your own practice?
Absolutely. I wanted the ability to create an experience that I was passionate about. When I was working for other plastic surgeons, I had to, do the things that that plastic surgeon wanted me to do, as far as, their core values, how they wanted to run their business. And I wanted it to be my way,
Mhm.
uh, because I'm also very passionate about caring for my staff.
Mhm.
I definitely it's very unique to have a boss who cares so much about their staff, who wants to run their practice a certain way. And I knew I had a specific idea in mind of how I wanted to run my practice.
Hmm.
Uh, so I definitely wanted to pursue opening my own medical aesthetics clinic.
Okay. And it's been a amazing success to this point.
It has. It has. It's grown very quickly, which I'm so grateful for. Growing to a multi-seven-figure business with virtually zero marketing dollars spent
Wow.
is, definitely a feat.
Yeah.
But I definitely run a practice that is so inviting,
Mhm.
welcoming. It's very unique.
Yeah. Now, I want to talk a little more about the treatments that you provide in your practice. What would you say are some of the most common treatments that your clients and your patients come to you for?
Our number one service that we offer is the injectable side of our practice.
Mhm.
We are very busy with neuromodulators and dermal fillers.
Mhm.
However, I'm starting to see a little bit of a shift in the aesthetics world to regenerative medicine. So
Mm.
I am very passionate about pursuing that side of the aesthetics field.
Mhm.
So I recently brought on advanced biologics, utilizing those to inject, delicate skin under the eyes, very fine lip lines, and I will also be pursuing different treatments as far as joint injections. So moving a little bit more medical as
Mhm.
well.
Okay.
Um, but for current, the injectable side of the business is still kind of the powerhouse.
Got it. Okay. And so for regenerative medicine, I want to dive into that because I'm starting to see a lot of medical spas, a lot of aesthetic practices starting to bring on these types of treatments. So people that don't know what regenerative medicine is, how would you explain it to a fifth grader? Like, what is it and what can it do for you?
It is utilizing your body or donated stem cells to induce an immune response. So, for example, if you are utilizing platelet-rich plasma, we are taking the patient's own blood, we
Hmm.
are processing it, re-injecting it back into the patient and expecting an immune response. And that immune response is a controlled immune response, but the act of having that immune response is going to stimulate the growth of your body's natural collagen. So
Mm.
the end goal of regenerative medicine is utilizing your own body to create a response to stimulate that growth of collagen. So
Mm,
it's
wow.
very unique
Hmm.
that, in comparison to our neuromodulators, our dermal fillers, for example, those are taking place of volume loss. However, there is no response as far as correcting the problem. And the problem is often lost collagen, lost bone, and lost fat, specifically in our face as we move through the aging process.
Hmm.
So when we use a filler, we're truly just replacing what has left the body. When we use regenerative medicine, we're relying on the body to create a response to solve what has left the body.
Okay. So it's almost like we're using our own body as our fountain of youth.
Exactly,
Okay.
exactly. There's been a lot of talk about, biohacking,
Hmm.
whether it's internally or using it as a surface treatment. This is definitely something that we're going to see a shift in aesthetic medicine.
Okay. And it seems like you were hinting at this, but are you using the regenerative medicine treatments alongside like filler and the injectables together, or is it really completely replacing it? Could you talk a little bit more about that?
I do use them simultaneously. I think they complement each other very well. For example, I use a lot of Sculptra in my practice, and Sculptra is an injectable made by Galderma Aesthetics to induce, again, an immune response to stimulate the growth of your body's natural collagen. So, if you use a product that's going to stimulate the growth of collagen in conjunction with neuromodulators, dermal fillers, you really get a beautiful result because your body can only respond so much
Mhm.
and can only achieve such a result. So if you combine the two, you really get a natural looking result. proper treatment places look, you have the correct light reflections when you're utilizing the natural and then also the dermal fillers.
Okay. And you did mention this also when it comes to regenerative medicine, you're using mostly your internal, I'll guess like your blood, I guess you can call it. But then you also mentioned something external. I can't remember the word you used for that. So when you say external, is that something that is like blood from other people? Is it from animals? Is it like, where is it coming from, the external part?
The specific, what should I say? The specific biologic that I'm using
Mhm,
is actually amniotic fluid.
mhm,
So, amniotic fluid that
mhm,
is donated via a healthy C-section
mhm,
goes to a tissue donation center, and that donation center, that is where we get heart valves, tendons for, knee replacements. So it is all going to the tissue center. It is going to be highly tested to ensure it is safe to be putting in our own bodies.
mhm,
So if we are utilizing donated, say, amniotic fluid,
mhm,
and re-injecting it, you are now inducing an anti-inflammatory response. So
mhm,
instead of PRP and Sculptra, which induce a pro-inflammatory response, now we're utilizing a product that is anti-inflammatory. So patients who undergo treatment with birth tissue biologics, they have very little swelling, very little downtime. And these cells that are found in the amniotic fluid that we're using, those are 0 day old cells. So the growth factors that are found in that are vastly different than our PRP because our PRP relies on platelets in our body that could potentially be 40, 50 years old. So they are vastly different as far as the efficacy and results.
mhm,
But this is a new treatment,
mhm.
um, and the world is still exploring it.
Yeah.
Uh, but it's really exciting to see these advancements in the regenerative medicine.
Okay. And you mentioned the pro and anti-inflammatory I guess processes for each option.
Yeah.
Now, if I'm the regular person, I'm thinking, oh, pro-inflammatory, I don't want that because I think about health. Oh, anti-inflammatory, that's all I hear about. Anti-inflammatory, you don't want inflammation. But it seems like it's just a different modality. So is there certain situations where pro-inflammation is actually good for where you're trying to get to, and it's not just everyone's looking for anti-inflammation?
Yes, very good question. It truly is the science of what's happening. I don't foresee one being greatly beneficial versus the other.
Mhm.
However, a lot of people in the world have autoimmune disorders. So
Mhm.
in those individuals, we don't often want to induce a pro-inflammatory process
Mhm.
because that could flare up their autoimmune disorder.
I
So if
see.
I can utilize a treatment that is anti-inflammatory, it is a bit better for those individuals in particular who carry an autoimmune disorder.
Okay, got it. So it's just if they have that autoimmune disorder, then you have to be careful. But if for the regular healthy person, that the pro-inflammatory process doesn't really matter. It's just part of the treatment.
Exactly.
Got it. Okay, makes sense. Now, going back to the either getting it internally or externally for the regenerative medicine side, I'm sure you've heard this from people, maybe someone that's a little bit older, like, oh, can I get just some young person's blood because, oh, they're younger and then the blood's better, and then can I just bring their blood into my body? I'm sure you hear that a lot. So could you talk a little bit more about, is that viable? Can that be done? Can it not be done? And why?
Yes. So we wouldn't want to be taking blood products from a younger generation. That process is very different than, say, taking amniotic fluid or Wharton's jelly. That is a very different product, and the body's going to have a very different response to it.
Mhm.
So if you're inducing somebody else's cells via blood, that is not it's not going to induce that same response
Mhm.
like the amniotic fluid would. So
Okay.
definitely wouldn't be advised
Okay.
to utilize
Mhm.
somebody else's blood.
Mhm.
Um, so you definitely want to be mindful of when you're having these procedures done, and you're using, say an outside source of whether it's, a blood product or amniotic fluid, we have to be certain that it is coming from a lab. So there's a lot of boxes that needed to be checked before someone would do that.
Okay, good to know. Because I'd imagine people come to you and ask you that question all the time. Hey,
Yes,
I
yeah,
don't, I know this young person. I just want to use their blood. I want to be
yep,
just like them.
yep. We don't want to do that.
Yeah. Okay. Now, I also want to bring up the point of anything from that's animal related. I am starting to hear things like using salmon sperm and things like that. So, is that something that using animal related products, is that really just topical where you can just kind of put it on the outside, or can you inject that into your body? Or in what cases would you want to use animal or not use animal derived products?
Yes. I feel that putting them topically in whether you're doing microneedling, RF microneedling, I think those are very appropriate places for those animal-derived products. I know people are injecting them, off label. I just personally don't feel comfortable because those studies aren't there yet. So anytime it's animal derived or synthetically derived, I'm just always a little bit hesitant
Mhm.
to jump on board before I inject that into a patient.
Okay. And you also mentioned that what you're doing on the regenerative medicine side is also injecting into the joints, which is something that I've worked with some regenerative medicine doctors kind of before the wave started to come into the medical spa side of it.
Mhm.
Um, and so it seems interesting that you're going into the joint side, which is, I feel like it kind of started there. But
Yeah.
not many people really go there. They're going more on the aesthetic side. So I guess what kind of led you to start looking at going into the joint side specifically for regenerative medicine?
I've always had a passion also for orthopedic medicine. I spent some time during my school or my graduate degree. We had a clinical rotation in an orthopedic facility where I did a lot of joint injections,
Mhm.
utilizing PRP, utilizing a part of the rooster comb, talking about animal-derived products. And I always thought that was very intriguing, where we are moving away from injecting joints with Kenalog, which is a steroid that can destroy a joint if
Mhm.
repetitively done
Mhm.
year after year. So it was very intriguing to me, even from my graduate schooling. I wrote my thesis on utilizing stem cells for joint injections. So it's definitely always been a passion of mine to
Mhm.
explore that further. I feel with the athletes, how children are involved in sports at such a young age, and we're seeing more and more sports injuries. So I think there's such a need for joint injections utilizing biologics
Mhm.
versus going down the road of utilizing a steroid.
Mhm.
And there's a time and place for both,
Mhm.
but I think it's really interesting to allow the body to regenerate and heal itself. So that's just been a personal passion of mine. And when I got into utilizing the tissue-derived birth products, I trained with a colleague of mine down in Utah who does a lot of joint injections. So I thought this was very intriguing. So I definitely want to pursue this and bring this back to my practice. And I would love to collaborate with orthopedic physicians,
Mhm.
chiropractors to offer this unique treatment.
Mhm.
So definitely a different side of
Yeah.
aesthetics, but I'm definitely very medically driven and have a passion for that.
Okay. Now, medicine, from the way I understand it, it's been around for a long time, but it seems like most people really didn't start kind of picking up on it until fairly recently, at least in the medical spa community that I've seen. So I'm sure that you get a lot of patients, a lot of clients coming in with lots of different misconceptions or myths about the treatments. So what would you say are some of the most common myths or misconceptions that you hear about this particular type of treatment?
Specifically, people think that we'll go back to PRP, utilizing PRP can yield the same result as a dermal filler. So I do a lot of educating to the patients that these are not going to yield the same results.
Mm-hmm.
Dermal filler is going to take up a place of volume loss, and PRP, PRF, that is going to stimulate the body to regenerate that collagen again. So they're two very different procedures,
Hmm.
um, which yield very different results. So that I do spend a lot of time on, specifically in the under eye area. I
Hmm.
think with time, since I've been in the industry for 13 years, that is all we used to do. We only would put filler in the under eyes. And now there are so many different options for that under eye treatment that it is very confusing to patients. They think it is all going to yield the same result. So that is probably one of the most common things that I'm educating patients on is PRP, PRF. That is going to give us a nice, strong home.
Hmm.
If we were to place filler there, you are strengthening the skin, you're brightening the skin, you're improving texture, but you're not yielding a big volume change. So I
Hmm.
think that's really one of the greatest misconceptions of regenerative medicine.
Got it. And you talked about education. So I wanted to dive a little bit deeper into that as far as how do you educate your patients on the benefits and even how you maintain your patients. I mean, I think just from the measure of the success of the practice, I mean, you go into multi seven figures in 4 years. I think that for itself speaks volumes as far as maintaining patients, but also the education side. So could you talk a little bit more about how do you educate, how do you maintain, uh, and how are you able to do it in a way where they just keep coming back to you over and over and over again?
Mhm. I think it's really important that you first develop the trust of your patient. When that patient comes in the first time, they are looking to you as the expert. I think it's super important that you take that driver's seat and explain every treatment in great detail. Explain to the patient what is this treatment actually going to correct? Because patients don't understand where these treatments are placed, why they're placed there. They just know that they came in with a chief complaint and a concern, and we are the experts, being the medical providers, that we need to direct and educate that patient on what will give that patient the best outcome, depending upon what their chief complaint was. So
Mhm.
I think number one, that consultation is so important to develop the relationship with the patient, and they will trust you. They are seeking you as the expert. They are not seeking you out as a salesperson. I think that's definitely a unique trait
Mhm.
that you can't often train people on. You have to connect with that patient on a personal level so you can gain that trust between the two of you. So
Mhm.
it's very important for me and all of my team that we continue to, do trainings. We go to cadaver courses, we do hands-on courses. We are constantly evolving with the aesthetic field of medicine, and I get very known to all of my patients. We constantly update policies and procedures based on the evolution of aesthetics. And I think if you stop doing that,
Mhm.
you're no longer the expert. So it's
Mhm.
very important to invest in education for yourself and for your team. So that is one of the biggest things that I think continues to bring patients back to me because they know I am always seeking the best treatment, the safest treatment. I will never sell them something that I also don't believe in.
Mhm.
And I think that has just given that confidence for that patient and provider relationship.
Okay. Now, what would you say? I guess what most important piece of advice would you give to someone who is looking for that expert in their market, um, that provider, and they just don't know where to start? I mean, what advice would you give to someone who's looking for that expert that you just described, like yourself, and how they can start looking around trying to find that right person?
I think it's important for the patient to first explore reviews, Google reviews, Yelp reviews, because those are candid, non-prompted, typically,
Mhm.
patient experiences. And if a patient that is seeking a provider can see that another patient had an amazing experience, you've already gained that patient's trust. So the way that I have grown my practice is word of mouth.
Mhm.
And that has helped tremendously because that patient comes in already trusting you because their friend had a great experience
Mhm.
or someone they saw on social media had a great experience. So I highly recommend, if you are an owner in a practice or a provider working in a practice, to always seek out reviews. Those
Mhm.
speak for themselves, and that really drives new patients to your practice. I think it's really confusing for the general public to go to a social media page of a provider and try to figure out their credentials, because I've learned that people are really good at making themselves look really credentialed in
Mhm.
the aesthetic field of medicine, where they say, as a blanket term, 13 years of experience in medicine. Well, what type of medicine? What is your training? Who have you trained with? Who have you worked alongside? I think it's so difficult for the patient to navigate that just looking at someone's credentials. So I would advise steering in the reviews section.
Awesome advice. Awesome advice. Okay, now I'm curious, Christina, when it comes to, I'm curious, what is your thoughts on creativity and how it applies to patient care? Because I mean, you have a pretty wide background as far as medical knowledge, but even more than that, I mean, you have the business side of it. I think you have the scientific side of it. So I'm curious because when people think about medicine, and I don't think they think about creativity, that's not the first word that comes to mind. But with what you do, how important do you believe creativity is?
I think it's really important because not only are you a medical provider, you are an artist as well. And that is something that can't be taught. And I think that is also difficult for the patient to navigate.
Mm,
How are they going to find that creative, artistic provider? It's difficult,
mm,
but that patient needs to go seek out the work of that provider. So in 2025, our Instagram page is our portfolio.
mm,
So you can utilize that provider's before and afters to really look into that creative, that artistic side of that provider, because not everybody has that skill.
mm,
And like I said, it's very difficult to teach that, almost impossible to teach that.
mm,
So you definitely need to seek out that provider that has that skill, because it's an aesthetic eye, an artistic
mm,
eye. It's not just delivering prescriptions, diagnosing, but it's also utilizing that creative side of your brain when delivering that result to your patient.
Okay. Now, I'm also sure that Christina, throughout your experience, you've had some challenging cases that have come through your door. Is there maybe one story that you can share that comes to mind that's just very memorable? Maybe just a case that was tough or that stands out in your mind, and how you were able to get them a good result in the end?
I think probably the most difficult case is the patient that comes into your treatment room expecting a facelift. And
Mm,
with my surgical background,
mm,
I think it has really taught me to deliver that expectation very clearly. But sometimes it's difficult.
mm,
The patient doesn't always hear that this is not going to deliver a facelift result.
mm,
So I had an older woman. She was in her, I think she was mid 60s, late 60s. So definitely had a lot of volume loss, a lot of skin laxity, likely a great facelift candidate. But a lot of times I see those patients that are just not interested in going the surgical route.
yeah.
So as the provider, it is my duty to convey that information to that patient and say, this is not a facelift. But in this particular instance, we had done a sculpture treatment plan, and I spoke to that patient over and over. This is not going to give you a facelift result. So we had completed the Sculptra treatment plan,
Mm,
which was spanned over a course of about 3.5 months. I had the patient return about 6 to 8 weeks later, and they were bummed.
mm,
They didn't see the results that they had envisioned in their
mm,
head. Even though I was very transparent, this is not removing skin, this is
yeah.
not lifting skin.
Mm,
So, as the business owner and the provider, when you're put in those situations, you have to recognize that that patient invested a lot of money to complete that treatment plan with you. They trusted you. So now I had to decide, as the owner, what am I going to do to make this patient happy?
Mhm.
Because that is so important that you have happy patients because
Mhm.
they will go tell their friends. So in that moment, I decided to offer this patient filler as a complement to create a little bit more volume and repositioning of the skin to give that visualization that that patient maybe had, a little more lifting, a little more tightening. And I did that complimentary. And sometimes you have to make those difficult decisions as the business owner. Am I
Mhm.
going to work for free today
Yeah.
or this hour
Yeah.
to make that patient happy? And that is always a goal of mine is to have happy patients because I know how that reflects me as the business owner as well as my brand.
Mhm.
So I made the difficult decision, but in the end, she was so happy that A, I took care of her, B, I recognized she invested a lot of money, and C, she was underwhelmed. And I took the initiative to take care of her and make that right.
Yeah, great explanation. I think that setting the right expectations is difficult, even when you try your best to set the realistic expectations. I think in their mindset, sometimes it's just different than what they're being told. Now,
Absolutely.
now, Christina, I'm curious, where do you think the future of aesthetics is going?
I think I think we will see more regenerative treatments. I don't know exactly what they will be, what they will look like, but
Mm-hmm.
I feel that I am having this shift in even in my practice that patients are really seeking out how do I improve my overall well-being? So we actually brought on bioidentical hormone therapy. We're bringing on NAD therapy. We're really seeing this shift in the patients really wanting to care for themselves
Mm-hmm.
inside as well as out. So I think as business owners, we need to recognize this shift that's probably going to happen here soon.
Mm-hmm.
And it's already started happening.
Yeah.
I've seen a shift in a lot of my patients are saying, hey, Christina, I'm not necessarily interested in neuromodulators once a quarter. I'm actually interested in caring for my skin, making sure it looks healthy, caring for myself inside and out. So I believe we'll see a shift in really taking care of that patient as a whole, from a holistic standpoint, from inside out perspective. I think people are really getting interested in caring for themselves, and not necessarily avoiding traditional medicine, but just seeking treatment options that allow patients to prevent disease, be a little bit proactive instead of reactive with their health. So I
Mhm.
definitely see that side of aesthetic medicine transforming a little bit.
Okay. And with that in mind, what is your vision for Remedy Medical Aesthetics?
My vision is to continue to grow in the holistic side of my practice
Mhm.
as well as that aesthetic side of the practice. Because it is important that when people feel good on the inside, they also feel good on the outside. And we can't ignore that we are all human. And if we feel better on the outside, when we look in the mirror, that allows us to also feel better on the inside. So I
Mhm.
don't think we should shift our practice so far out of aesthetics, because we're all human. We all want to look good, on the outside as well as the inside. So I think my vision and my goal is to really increase both sides of my practice and have both sides of that practice work simultaneously together and have that patient be seen on the wellness side as well as the aesthetic side, where we're really seeing those two sides of the practice complement one another.
Okay, very well said. I guess it's almost like you're trying to have this self-perpetuating loop where if you feel good on the inside, you feel good on the outside. The more you feel good on the outside, the more you feel good on the inside, and then it keeps going and going and going.
Absolutely.
Okay, awesome. Well, Christina, I have one last question for you, but before I ask it, I do want to point people to your website at remedywellnessclinic.com. Now, the last
Yes.
question is, what does beauty mean to you?
Beauty means to me looking in the mirror and having confidence. Whether that is looking in the mirror and loving how you look, looking in the mirror and loving how you feel, or both. There is nothing better than having self-confidence. So truly seeking that internal and external self-confidence.
Awesome. Well, there you have it. Kristina sharing her expertise. So, Kristina, where can people contact you in your practice?
Yes, they can contact us via our website, via email, text. They can also find me on Instagram. It is remedy.kristina, or remedy.well on Instagram is our main business page as well.
Awesome. Well, Kristina, this is great. Thank you for coming on, sharing your knowledge about regenerative medicine, talking about your practice and the future of aesthetics. This is great. So thank you again for coming on.
Thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.